From the NewsChannel 5 network, this is Out and About Today. Sponsored by the Tennessee Performing Arts Center.
Welcome to Out and About Today. I'm Brent Meredith. We've got an informative and special in-depth men's health episode in store for you tonight. I'll be talking with urologist Dr. Matthew Pollard, MD, from Nashville Men's Health about a variety of men's health topics in which he specializes. And we've got a lot of ground to cover tonight, so let's get started straight away by welcoming Dr. Pollard to the show. It's a pleasure to meet you, Dr. Pollard. How are you doing?
I'm doing great. Thank you for having me.
Well, of course. And I really appreciate your time tonight, and giving us a whole show's worth of your time is wonderful, because I know you have a lot of services you offer and a lot of things we're going to cover. But I'd like to jump right in with what I normally like to do with any guest, is just get a little bit of background about yourself and why our guests watching tonight should take your advice. So can you give us a little bit about sort of how you entered medicine and your education and how you ended up here with us tonight?
Absolutely. So I actually grew up in a family full of doctors. So my grandfather was a doctor in a small town in Texas. My mother's a doctor. My father's a doctor. And so, of course, when I went to college, I said, there's no way I'm going to be a doctor. I initially started studying theater, and then it quickly became clear that what was going to be the most rewarding for me in a career and the way that I could contribute the most to the world was to actually pursue a field in healthcare. So after a year in theater, I switched to a public health major at USC in Los Angeles. And I spent a lot of time volunteering in Los Angeles and also abroad internationally with different volunteer organizations, and decided to apply to medical school. I ended up choosing to go to medical school in New York at Mount Sinai School of Medicine, and that's where I got my medical degree. Quite
a journey from theater to doctor. That's interesting. But sort of
absolutely.
What made you decide or sort of land on specifically urology, along with what a urologist does?
Yeah, so urologists focus on everything from the kidneys down to the bladder and anything with the reproductive organs as well. So anything with the urinary system or the reproductive system. So as a urologist, I specialize in benign urology, which are things like an enlarged prostate or urinary issues, things like what I do in men's health, which includes erectile dysfunction, low testosterone, Peyronie's disease, as well as enlarged prostate or urinary issues. But we also cover things like cancer of the kidneys, cancer of the bladder, cancer of the prostate, and also the testicles. For me, when I chose to go into urology, I was a first-year medical student. And one of the first choices you make in medical school is whether or not you want to go into a surgical field or a medical field, because one is more procedurally based and one is more clinic based. Between my first and second year of medical school, I ended up working with a urologist in Los Angeles during the summer, doing some research projects and also shadowing her. And I loved that a lot of urology is focused on improving the daily quality of life of our patients. So I was really inspired by the way that urologists can not just treat a disease process, but also improve sort of the baseline quality of life of anybody who comes to see me. So my goal whenever I see a patient is to improve their daily life. So not just treating, they come in with an acute illness or a cold or a cough, but changing the way that they experience their health and their daily life.
I can totally understand where that would appeal to someone like yourself with sort of an outgoing personality and wanting to, make everybody's or everyday life better. Now, how did you end up here in Nashville? I mean, you've got sort of a long track of hopping across the country. How did you land here?
Yep. So I did my residency after finishing medical school in New York. I did residency back in Los Angeles at UCLA, and there I worked with my mentor, Dr. Jesse Mills. He joined the faculty at UCLA while I was there, and I was fortunate enough to work with him in the later years of my tenure there. And he is a men's health specialist as well. And so before he had shown up, I wasn't really sure what field of urology I wanted to do, or if I wanted to focus more on general urology. But after working with him on things like erectile dysfunction, low testosterone, Peyronie's disease, kind of the full gamut of men's health, I really decided that was the field that I wanted to go into. So I actually did a fellowship after residency, which the way the medical training goes is you finish college, obviously, and then you go to medical school and you do a residency in your chosen field of medicine. Once you finish a residency, you can either go into practice and basically become a general practitioner of whatever field you're in, or you can do additional training to become a specialist. So I chose to become a specialist in men's health and male infertility. And so I did a fellowship in Houston with an excellent physician named Dr. Larry Lipschultz. And so he's sort of one of the founding fathers of male infertility and men's health. So he is an incredible microscopic surgeon. He taught me pretty much everything I know about what I do. Once I finished my fellowship, my husband Howard and I were looking to move to either a medium to large city somewhere in the U.S. We weren't really focused on a specific region because my family lives kind of all over the country, and we recognized that there was a huge need in Nashville. So before I moved here, there was no fellowship trained men's health specialists in the city. So the closest male fertility specialists were located in Louisville, Kentucky, or Chattanooga, and there was nobody in Nashville who was offering fellowship level training to the people who live here. So I recognized that there was a need here, and we decided that Nashville would be a great place to live, and so here we are.
No, it's great. I mean, all signs pointed to here, and much to our gain, from what it sounds like. I did not realize you were the first to be here, so that's fantastic. And as part of being the first, I noticed you've got a great outreach program. Your website is fantastic, Nashville Men's Health. I was curious if you wanted to talk a little bit about your practice and sort of how that came to be.
Absolutely. So as in building my men's health practice here, I really wanted to have sort of an identifiable brand associated with what we're doing, because yes, I treat male infertility, but I also focus on all areas of men's health. So I wanted to kind of have an overarching brand that encompasses everything that we do. So at Nashville Men's Health, we're focused on providing the highest quality healthcare that we can to men all across Middle Tennessee, focusing on erectile dysfunction, low testosterone, enlarged prostate with urinary symptoms, Peyronie's disease or penile curvature, as well as anything male infertility related. So we are sort of a one-stop shop for anything that is related to urology that a man can experience either when he's younger and trying to have children, or as we age and start to notice some changes in our bodies.
Well, thanks for that great overview. And I know we're going to dive into some more specifics about some of those areas after the break, but we do have to take a short break, and we'll be right back with more of our special Men's Health episode after this short break. Stay with us.